We have a straight 3 versus 3 divide on this very important subject. Dr. Prabodh Ganguly, CEO of Vision Intellectual Property Rights from Mumbai. Kewal Handa, Chairman of Medibiz and former Managing Director of Pfizer, with me in the studio. Thank you very much for coming. Dr. B.S. Ajay Kumar is Chairman and CEO of the HCG Group of Companies. He says it's a short-term benefit for India. I support patents only for the short term. Dr. Samir Kaul says government should have stepped in earlier because prices should be negotiated. Playing a very critical role, counsel and lawyer for Cipla, Pratibha Singh, and senior advocate and director of the Lawyers Collective, also a lawyer for the Cancer Patients Aid Association, Anand Grover. Sir, my first question is to you, Mr. Grover. You are very clear. You are saying companies like Novartis are only interested in profits at the expense of Indian patients. Can you elaborate your position, please?
First of all, if you look at the present case, Novartis did not invent this drug. This drug was invented through public funded projects by a person called Brian Drucker in the United States. This is an orphan drug. They got tax breaks. They did not even put $400 million for the whole of the marketing. But they reaped $1 billion in the first year. This is not an invention. There's no innovation in it. And the Supreme Court has rightly said that this is a drug which is hit by 3D. It's just a new form of an old drug. It doesn't deserve any patent. Most of the companies in the US and Europe, North America and Japan, 76% of the drugs are those drugs which are new forms. These are the ones that are being patented. Therefore, in India, we brought in 3D, which says the new forms of known substances should not be patented. And this is the case of that type. The Supreme Court rightly rejected the claim of the Novartis company on
the other side,
which is Gleevec, which is the drug.
On the other side, you have two gentlemen, with contrary positions. I'm going to come to Dr. Prabodh Ganguly, who actually supports these patents. He says that because of today's judgment, innovation may not take place and Indian patients will be worse off because of this. Kewal Handa does not agree with this profit-making motive thing. Tell me, Mr. Handa, here's a situation. This drug called Gleevec, in India, it is available. A patient can spend some 7,000 or 8,000 rupees a month and use this drug, kidney cancer patient. Tomorrow, what answer will you give to a kidney cancer patient who will overnight, had the judgment been different, have had to sell over ₹100,000 rupees? Where would the money come from?
At the outset, this particular drug,
yes,
Novartis has given $1.7 billion of the drug free to the patients in this country. 95% of the patients get this drug free. I think, and the balance 5%.
What's the guarantee they'll keep getting the drug?
They are getting it for so long. And I think this data point that this drug is 1 billion in India is not true. So I think we need to get our data as facts.
No, you answer my question here. My question is that suppose
I'm sorry, this is not correct.
You want to contest? Okay, go ahead. Anand Grover, please contest. I'm coming to Pratibha Singh also, please.
No, because this data was contested by us in the Intellectual Property Appellate Board. Novartis did not rebut what we said. They have no answer. And this is data from Novartis itself. And the so-called program, which is called GPAP, it's a fraud. They know it very well. That was also contested by us. They did not rebut it. So please do not raise issues which have not been rebutted by Novartis in the court. Don't use this television medium to push their agenda.
No,
Mr.
I am
Handa,
not pushing anybody's
understand.
agenda. This is a public knowledge. They have made statements.
You are.
They have made statements.
Because you are not, you didn't have the chance, you had a chance to rebut it, you did not do it. And don't spread those false notions across television.
I don't agree with you. 16,000 patients are already on this data, on this drug. And if you look at the value of this drug in the market,
they are there only because you want to push that agenda.
No, I don't agree with you on that point.
I want to say.
But the broader issue is
we have patients who are getting free drugs also.
The broader issue still remains. The broader issue still remains. That 3D is not been neutralized by the court.
No, the broader issue is very simple actually. Yeah. Samir Kaul wants to come into the debate. The broader issue is this, that today there is a person who is having end stage or second stage or third stage or first stage, whatever, kidney cancer. And he needs this drug. Now, had the Supreme Court verdict been different today, he would have to find a way to get 1.5 lakh rupees a month to survive. I want to know the argument against.
Arnav, why are you penalizing a pharmaceutical company for lack of healthcare safety net?
I am sorry, but the reality in India is that no government of India will pay a patient 1.5 lakh rupees.
No, there
to
could
get
be
that drug.
There could be a different vehicle to get this.
Samir Kaul wants to come in. Samir Kaul, who's hyping this here? Me or the gentleman sitting next to me? Yeah.
I think, gentlemen, good evening. As somebody who actually real-time uses these drugs on patients, we're not talking about kidney cancer today. That may be a similar issue, but we're talking about Glivec, which is used for chronic myeloid leukemia. A cancer, the patients of which young patients actually live after they did this drug. So, in a background of patients who have got more access to this saving of their lives today, I have to make a couple of points very clear. That I'm happy on 3 counts. I'm happy on the fact that this judgment today, which I'm sure that our preeminent jurists will decide whether this 3D was applicable and they actually had an innovative increment or didn't have. But what I can tell you today is that this was an epoch-making decision today, because today this country is talking about patient rights. And it has actually achieved so much of public attention that we are debating it on national television tonight. I am happy for that. I am happy for the fact that many more patients below the poverty line will get access to this drug. I'm also happy for the product that today, if ever, that our own pharmaceutical companies will realize that they need to do more in the research and development.
Oh, absolutely.
But on the other hand, gentlemen, can I just last, can I leave you with a word of caution? That rather than painting this whole thing as an East India company having come back and robbing our country, there are many products which are way away from our own research and development capabilities. And I'm talking about Herceptin, Trastuzumab, autoimmunoconjugates, Baxter, and a whole lot of them for which there will not be a foreseeable R&D in this country.
Sure, there isn't, but I'm talking about tonight. I'm talking about tonight. My question is, yes.
Hello?
Yes, I'm coming to you, Dr. Ajay Kumar. Please tell me, you are saying, if Novartis is such a great company, if it wants to help the poor people of India, then why would it stop poor kidney patients in India, kidney cancer patients, from getting a drug at 1/10 the price? Why would it do so?
I want to intervene.
I'm coming to you, Pratibha Singh, just after Dr. Ajay Kumar completes. Dr. Ajay Kumar, please, in Bangalore. Samir Kaul, you had your say. I'm going to Dr. Ajay Kumar. I'm going to come back to you after that.
I want to say...
No. I just
as an oncologist...
It's not about
as an oncologist.
Kidney cancer is Pfizer. We're talking about...
it is about chronic myeloid leukemia.
Come on, sir.
Hello.
Yes, go on.
Let me say a few things. It is a drug approved by the Drug Controller of India for chronic leukemia and a condition called just tumor. These are the only 2 conditions for which it has been approved. I'm a practicing oncologist, practice abroad and here. All I want to say is, while I am all for generic drugs, affordability is a factor. What I want to say is, for a short term, it's definitely beneficial. But having said that, somebody like Novartis, with whom we work very closely for patients, for all below poverty line people, they give free drugs. For all people who are middle class, there is a scheme under which they benefit. The cost to them on an average per year is 2 lakhs.
I'm sorry.
But,
today,
2 to 3 lakhs.
Today, the Novartis president said.
I want to say something.
No, sir. I'm questioning the altruism of the company. 1 minute, sir. 1 minute, sir. Today, sir, Sir, 1 second. Dr. Ajay Kumar. Here is a company which told us today, no other global company will invest in India for research, given the current atmosphere. We are being told you will not have medicine for your children.
No, I want to ask you one thing.
1 minute.
Why are we Why are we as Indians are not innovators? Why can't we produce
That's another
drugs?
issue.
Why can't we go to
No, no,
biosimilar and be
don't
copycat?
sidestep the
Why
issue.
can't we really make the drugs ourselves?
Sir, I'm asking, don't sidestep the
Why is
issue,
it
sir.
not correct?
Pratibha
I
Singh.
am in oncology. I know for
Sir,
a fact
sir, this-
that
I think
India has never been innovator.
Sir, the question about Indians being innovators will be discussed later. Today I'm asking you, how can an Indian be denied? How can any foreign company come into our country and tell us
No, we are
whether or not
denying.
the poor
See,
people
what
of
I want
India
to
will
say
have
is
drugs?
we
Sir,
are the
please.
largest cancer care providers in the country.
So one-
and we treat 45,000 new patients. The incidence of chronic myeloid leukemia is 1.5 per 100,000 population. There are 60,000 active patients with chronic myeloid leukemia.
Yes,
Majority have been supported. Those who deserve have been supported.
So who decides?
I treat
I
patients who have
don't
been
totally
supported.
disagree with
What
this
I want
data,
to say is,
which they are
for a
now trying to
short-term
put
goal,
out.
Who decides?
we should not forget the
Sir, who
long-term
decides?
goal of
Sir,
looting
I'm sorry.
innovation.
Who decides whether or
No,
not?
there is a system where we decide. We have medico-social workers,
Sir,
below
the-
poverty line
sir, the
people,
question-
those who cannot afford.
Sir,
Those
the-
who
This is all
come in
propaganda by Novartis.
BMWs,
One minute,
Skoda
one minute.
cars, they cannot be given
I'm
free
getting to
treatment.
Pratibha Singh next. Pratibha Singh, I actually, please, Dr. Ajay Kumar, please understand one thing. I am not, the debate about whether we should be innovative or not will come to. Innovations don't happen overnight. Innovations take years and a lot of money in development. I am
The only
asking
thing is
you.
deserving people should get free care.
Yeah, sure,
Not
then.
everybody. Those who can afford to pay, why should they get free care?
So that is not for a foreign company to decide tomorrow. Pratibha Singh, why don't you respond, please, to the points made
No,
by
not
Dr.
for the
B.S.
BMS
Ajay Kumar.
system where
So what?
they're evaluating-
See, there
Pratibha
are,
Singh,
there are
counsel for
five-
Cipla, the Indian company, please, is responding to you, sir.
Yes, yes. There are 3 or 4 more important points that I need to highlight. Firstly, imatinib was a pre-1995 drug and was not entitled to patent in India. What Novartis tried to do in this Gleevec patent is, in 1998, to apply for a patent by saying that this is a beta form of imatinib mesylate, which was a pre-1995 drug. The Supreme Court has rightly held that imatinib was known, imatinib mesylate was known. The mere fact that beta form is more soluble, more stable, or more hygroscopic doesn't entitle it for a patent. And that's a very, very simple analysis which the Supreme Court has done. And there is no one to answer as to why, when in 1993, Zimmerman got a patent for imatinib and India did not have product patents, why was this backdoor being used to register a patent and to exclude all generic companies from making a drug which was covered by the 93 patent and not by the 98 patent?
See,
This is something that we cannot answer, and the Supreme Court has rightly held that this was a 1993 patent. There was nothing new in 1998,
Yes.
hence Gleevec is not entitled
Yeah,
to it.
and besides the
we
point
should
is...
first deal with this issue as a technical issue.
No, besides, I think the point here is, Dr. Ganguly, sorry to come to you last, the question is, as even Justice Iyengar observed today, the provisions of a patent law have to be designed with specific reference to the economic conditions of the country, its future needs and other relevant factors. It cannot only be from the point of view of the drug pharmaceutical company. It has to be from the point of view of the patient and the economic circumstances in the country, of the country. It can't be oblivious to them, Dr. Ganguly.
Adam, I just want to add one thing before Dr. Ganguly.
Yes, Dr. Ganguly, please continue.
Hello, can I?
Yeah, please continue.
Yeah. What I want to say is that first of all, I would like to say that people are getting completely submerged in emotive matters and not in substantive matters. So therefore, we must keep the emotive matters a bit away if we want some logic to come on the forefront. So therefore, I would first like to submerge the emotive matters away and come to substantive matters on this.
Now, what is the emotive matter? Please explain. What in your view is it? No, what in your view, please tell me, Dr. Ganguly, what is the emotive matter which is of no relevance to the debate? Whether cancer patients live or die as a result of this judgment?
No, I did not say it's of... No. I did not say it's of no relevance. I said you must look at emotive matters separately. For example, the issue of prices and whatnot have to be looked into in the context. Now, first of all, that people have to invest heavily to come in with innovations. Innovations don't come from nowhere. So that's the first part. Second is that any patent law is a quid pro quo. And in that, what happens is that whatever innovations you have done, you disclose, it's to be evaluated within the framework of the patent law of the country, and then you come to a conclusion whether it's patentable or not, and whether you would give the monopoly to that, into that company or not. In addition to that, there are other balancing factors in a patent law.
Sir, Dr. Ganguly, may I please just respond to you firstly on your first point? I want a counter question to you. One sec. I just have one question to make to you. Please, Pratibha Singh, I'm coming to you in a minute, please. Sir, what you say emotive, now let me tell you, the scientist behind this life-saving drug, Glivec, Dr. Brian Drucker, he writes a column in a newspaper in India in which he is totally critical of the pricing strategies and patent policies that do not allow such drugs to reach patients. He says this in 2007. No, 1 minute. So is he being emotive?
Let us first come to the point as to what is an innovation, what's an invention, and whether it's patentable under the Patent Act or not. I would first say that Anand, what he said in his opening remarks, I think Anand has misquoted the patent law in India. The patent law does not say in section 3D that what it says is that the mere discovery of a new form of a known substance which does not result in enhancement of known efficacy of that substance is not patentable. But then there is an explanation. And the explanation which goes with it, which you have to read with the section, is that it says, other derivatives, etc., of known substances shall be considered to be the same substance unless
why are you
differ significantly.
No, one second. Dr. Ganguly, I'm afraid to have to say this, but I feel, Dr. Ganguly, that you are trying to steer the direction of this debate into some techno-legal argument, trying to avoid a very basic question which I'm putting to you. And I'm challenging you, Dr. Ganguly, today to respond to what I'm asking you. 1 minute. Dr. Ganguly, 1 minute. 1 minute, Dr. Ganguly. Let's debate it one-on-one. I'll come back to you. Dr. Ganguly, may I invite your attention, please?
Come in.
No, 1 second. Dr. Ganguly, Brian Drucker is the scientist behind this drug that we are all claiming. He says, and I quote, pharmaceutical companies that have invested in the development of medicines should achieve a return on their investments. However, he says, this does not mean the abuse of these exclusive rights by excessive prices and seeking patents over minor changes to extend monopoly prices. This goes against the spirit of the patent system. Without access, medical research becomes a luxury good. I am asking you, Dr. Ganguly, and I am asking you, Keval Handa and Dr. B.S. Ajay Kumar, why should a cancer-saving, life-saving drug become a luxury good so that only the super rich of India can afford?
No, 1 minute.
That's not an emotional argument, I think. Dr. Ganguly takes the question first.
Please understand.
Yes.
I want to say...
Please understand that
as a doctor,
even Dr. Drucker, wouldn't have come with this invention. Just 1 minute. Can I bring in that first of all, Dr. Drucker wouldn't have come with this invention if it was not funded. So the point is that somebody had to fund his entire work to bring that into picture.
It wasn't funded by Novartis.
So what's Anand Grover? Anand Grover, please.
Arnab, it's very important to remember that the funding was by public authorities. It was a publicly funded project. But Novartis is actually making money out of publicly funded projects. The estimate of how much they've spent is less than $400 million. And in the first year, they recouped $1 billion. This is from their own website. And this other program of free donations, we challenged that, as I said earlier, in the Novartis case, and Novartis had answer to it. But these gentlemen, obviously, who are paying lip service to Novartis and their machinations, they are now putting this data to obfuscate and use them as a propaganda.
I'm sorry, but I'm going to keep asking that one question.
Anand, I think...
Ajay Kumar, Dr. Ajay Kumar is coming. Dr. Ajay Kumar, Dr. Ajay Kumar, please, after that, Samir call come with you. Yes, Dr. Kumar.
No, I want to say that we are actually users of the Novartis program. Where is the lip service? We use hundreds, thousands of patients have benefited from this.
Why didn't you answer
and
that in the case then?
Thing for me,
Why didn't you answer that in the
also
case?
Running the cancer center. Let me finish.
You did not answer this question in the case when it came up.
Get this kind of treatment.
We know patients who were deprived because they were poor.
But all I want to say is
GPAP program.
there are people who are used. Let me complete. Please give me a chance.
No, because you are actually not telling the truth.
At short sight, what is going to happen? But long term, cancer patients are not going to benefit. They are going to suffer because of this judgment.
Really, one second. Dr. Ajay Kumar, 1 minute. Dr. Ajay Kumar, I have a question for you.
Why are we going to suffer?
Dr. Ajay Kumar, 1 minute. Dr. Ajay Kumar, please answer my question. 1 second, please.
Yeah.
Dr. Ajay Kumar, don't dodge it.
Yes.
Don't dodge it. You tell me today.
Yes.
Are you telling me...
What is your question?
Yeah, thank you. Are you telling me that every single cancer patient who can benefit from this drug, Glivec, is being given free drugs by Novartis? Every single. Mark my words.
Yes. Approved.
Every.
No, not every patient. Those
how many?
Those who are below
how many
poverty
don't get
line
it?
have been given
how
free
many
drugs.
don't get it?
Nearly 16. Right now, 16,000 patients are on active treatment.
How many patients are there
And
in
all
India?
I want to
1
say
minute.
is
1 minute.
this
Answer my question,
particular
doctor.
drug-
How many patients
Yes,
are there?
16,000 patients.
1 second, please, sir. Don't show this as your corporate
See,
social
there are
responsibility,
60,000
please.
patients diagnosed every year.
No, 1 second. You are telling me how many get it. I am asking you how many don't get it. 1 second. How many don't get it?
60,000 patients get it.
How many don't get
16,000 are getting free drugs. And the rest are in a program, those who cannot afford unsubsidized therapy.
No. How many don't get it? Don't get the free drug.
Arnav.
1 second, please. How many
No,
don't?
how
There are
many-
more than 25,000
those who
patients a
deserve all
year
are
coming
getting.
onto the...
Are you saying all these 30,000 patients, you don't care whether they live or die?
Arnav,
I mean, let's be realistic in our country.
All of them are getting
we are
through
clouding
this program.
two. We are
No, we are not.
clouding,
Look
we
here,
are
I am a
clouding two
doctor. You
issues.
think I will let anybody not receive the treatment?
Well, really, will you take responsibility for giving 1.5
All
lakh
deserving
rupees?
patients are getting the treatment.
Please be realistic here, sir.
No, I want to make one
Arnav,
statement.
we are
no
clouding.
patient with chronic
Arnav.
myelocytic leukemia
Arnav.
is dying because of
Coming
lack
to you,
of
sir.
drugs.
Samir Kaul responding to Dr. Ajay
They
Kumar.
are.
Samir Kaul.
Arnav, I must put it on record here, gentlemen and ladies, that I have used the GPAP program, which is the patient access program of Novartis, and so have many of my patients. But I must tell you that this program, which was outsourced to an NGO, didn't access a lot of patients for various reasons, and it could have been run better. Now, let's all agree on that. But yes, they do have a program. They did make an attempt to access the patients, but that's all right. But let me for a minute bring in the role of the government here. Yeah. What has the government been up to? Why should the patent office have patents running up to 10 years, 20 years? Does it make sense? Is that not restrictive to innovators? Why can't they have shorter patents and give a head start for 2 to 5 years and let the others catch up? For that matter, why wouldn't the government renegotiate the price? In fact, I feel there hasn't been a serious engagement out of court, the government, whichever department is involved, to renegotiate the price, which is more practical for a country like ours.
See, I think we are clouding two issues here. We are signatory to the TRIPS. We have a patent law, whereby we are supposed to respect and honor patents.
Yeah.
Now they have to be judged on the legal grounds, whether it is patentability or not.
Yeah.
This judgment clearly talks about 3D for Glivec only, and doesn't say that for future products 3D is not applicable.
Yeah.
Now look at history after 2005. Most of the products are being challenged. They are either being revoked or being copycats have been launched. Now, what messages are we giving to the global world? We have a law.
What is the guarantee? Please, I understood that logic. All of you are pushing it. Pratibha Singh wants to. One second, please. One second. Here the other side. Pratibha Singh's been saying something.
Yes.
Yeah, go ahead, Pratibha.
I don't agree with what is being said.
Gentlemen, for a minute.
1 minute, Samir Kaul. Let Pratibha Singh come in. Yeah, Pratibha Singh responding, please. Yeah.
Yes. Arnab, I have 2 points to make. Firstly, responding to Mr. Kaul, Professor Kaul, the term of patents is something which is prescribed by treaty, which is TRIPS, and that is 20 years. It has to be uniform. It cannot be less than 20 years. Number one. Number two, insofar as patents being granted are concerned, there are a large number of patents which have been granted by the Indian Patent Office which have not been challenged. But they never become a part of the media debate because they've never been challenged. So I don't agree with the argument that most patents have been challenged. In fact, we have a list of molecules where the patents are there and there is no challenge
So
to them.
the question is that I frankly, one second please. Pratibha Singh, I am not saying that any Indian company, 1 minute, I am not saying that any Indian company, even maybe those you represent are doing it for altruistic reasons. Let's be very clear, all pharmaceutical companies have business interests, right? Let's be clear about that. The only point I'm making, which I am afraid none of the panelists can dismiss, is the question of affordability. Wait. 1 second. Don't say the issue of tomorrow you create a situation where you have a monopoly and then you use the monopoly to say, I'm very sorry if 99% of Indians can't afford 1.5 lakh rupees a month. You'll have to die. But I will not provide you that drug because I have the monopoly. And I don't think, Prabuddha Ganguly, you can simply dismiss this as an emotional argument. Prabuddha Ganguly, this is the argument. No. This is why we are debating it today.
No, Arnav, you take a case of Merck. They have launched a product at 1/10 of the global price. And it's still being challenged on the affordability
That's not an answer.
No, that's an answer.
That's not an answer.
How low can you go? How low can you go? You can be challenged on any price.
$10 billion of drugs are provided by India to the entire developing world.
So
by your logic, it doesn't matter whether not just the poor people of India, but the poor people of the rest of the world die.
I'm not saying that. We need to have an alternate mechanism to service the poor people. Affordability is a larger issue, which you cannot ask the pharmaceutical companies to build.
Well, the pharmaceutical companies have to have a heart.
No, of course we have a heart.
Where is the heart?
Of course we have a heart. We spend so much, 20% only of the drugs can recover the research
That's a
cost.
Ridiculous argument.
No,
How many people do you reach? How many people do you reach?
You need money to invest in the R&D.
Well, when you don't...
Where do you get the money from?
Well, when you do, there is no guarantee. You give me a guarantee today, the next product patent that you will get, you will cover each and every...
But that nobody... Is the Indian companies covering the pharmacy of the world?
What?
Now, let the Indian companies give a guarantee. They are covering the Indian patients in this country. Which Indian company is giving an access program? You tell me.
Well, India...
You quote a single Indian company with access program.
Well, how many...
You quote me one.
Quote me a single Indian company in turn. Quote me a single Indian company in turn which charges 10 to 20 times the cost of the local medicine from its nearest competitor.
If there are no competition, the Indian company charges much more than the cost of the product.
Well, I'm sorry here to say this as an excess. Tomorrow somebody will say that I will charge you 100 rupees. 1 second. You make an innovation to crocin tomorrow and you say I'll put crocin available at over 100 rupees.
We are again mixing patentability with affordability. Let's keep these two separate.
The issue is affordability.
No, if the issue is affordability, let's look at the mechanism of affordability. Don't curse the innovation because of affordability.
Samir, call please. 5 minutes into the debate, I'm extending this.
Can I just ask them one question? One question, please. I understand there is billions of dollars worth for a molecule to get into the drug form. I understand there are 18 to 20 years. But why can't they operate at lesser profit margins? How about the other multinational companies? Take example of Roche. And the others, look at how they brought by packaging it in India, entering into collaborations, they brought the price of these expensive biotech products like Herceptin and others less, which means they were sensitive to our concerns. So what's wrong with that? To work on lesser profit margins and be sensitive to the pricing and the population of the country that you operate in. I'm not saying don't make money, but you can change the margins.
Most of the multinational companies do have a tier pricing
Roche,
now.
Like Cipla.
Well, the question...
Most of the companies have tier pricing. I'm giving an example of Merck, which launched this product almost at 5 or 10% of the global price. It's being challenged on affordability. Now, where do we go from here?
I'm asking about Glivec. You have not given me an answer for Glivec.
Again, Glivec, 95% of the product is given free. What else do you expect from
today? I'm asking you here today to all the private pharmaceutical manufacturers, where is the balance between research and innovation and keeping private players under check so as to not escalate the cost of medicines to a point where it's totally unaffordable to the poor? Dr. Kumar, don't give me only the cost talk about innovation. Both you and Prabuddha Ganguly are saying innovation comes at a price. I understand. But at what price?
No, I want to
You want to make only Indians pay.
No, let me talk about affordability.
That is also not
Now,
correct.
what I want to say is, in India, all this is because there is no insurance on a national scale.
Oh,
There is
oh,
no social
Mr.
security,
Oh,
there is no
oh,
Medicare, Medicaid system.
really? Really?
So, what happens is, unlike the Western countries, people have to pay from their own pockets.
Really?
And that is the reason affordability becomes a factor.
Now I'm going to ask you a question.
I can tell you as a
No, I'm going to ask you a question. Since a lot of you are trying to confound the issue, sir. Sir, you are trying to confound the issue. You are trying to
you've properly
Can I
packaged.
butt in here?
All patients can be treated.
Sir, you
Even
are trying to
below poverty
confound the
line,
issue.
There are schemes to treat
Sir,
them.
let me tell you, you people.
No, it is very fashionable to say affordability.
No, I'm not saying anything fashionable. I'm saying
Bangalore real estate, Mumbai's real estate is one of the largest, more than Manhattan.
Oh, great.
But to say
So by your logic,
think of who deserves. For them you have to pay.
Sure. So by your logic, I'm sorry, but if you're homeless in Mumbai, you're homeless in Mumbai. Similarly, if you have to die untreated, you have to die.
Homeless in Mumbai will take care. They will take care. But if you have a large apartment in Mumbai, you pay yourself damn well. You pay it.
Mr. Doctor,
you should pay.
Dr. Ajay Kumar, I don't know who's getting emotional in this argument today. I don't know.
This cannot be low cost for everyone.
Sure. So I'll ask
India
you.
is one of the cheapest healthcare provider in the world.
Yeah. So I'll ask you one.
Cheaper than Africa for your information.
Sure. And I'll ask you one question. Prabhuda Ganguly, 1 second. The question is to Ajay Kumar because he's getting very worked up in the debate. Tell me, Dr. B.S. Ajay Kumar. Now you know what this means. No, you know what you're saying. You go and say in the streets of New York tomorrow, right, that I will make a cancer drug available at 10 times the per capita income of the average New Yorker. Okay? That if an average New Yorker has cancer, I will make the drug available to you at 10 times your per capita income. Right? And too bad if you can't afford it. I can assure you, one second, don't criticize the system, be realistic. You're an Indian, sir. Would the government of America be able to insure Americans if the cost of a cancer drug was 10 times their per capita income? That is exactly the purchasing power parity terms that I'm describing.
First of all, it's
not astonishing.
Apples to apple.
It is apples to apples.
Apples to apple, because America covers majority of
I am saying apples to apples. Human beings in New York and human beings in Mumbai.
India has failed. The government has failed to cover these people.
Don't blame the government.
The blame on innovators, whereas the government is at fault. You should take the government to task. Why have you improved your per capita income?
Sir,
Why have you not? Why have you squandered the national wealth? You should ask them. Not going after the innovators who are long term will be beneficial for the cancer patients.
Really? Well, I asked you a question and you didn't answer. Yes, Dr. Ganguly. Dr. Ganguly is coming in. After that, I'm getting the other side.
What I'm trying to make is very simple. The point that I'm trying to make is pricing and other pricing models should depend on the policy of the country, the policy that the government would make. So I'm coming in from the point of view that if there are new drugs, new treatments, new systems are to be developed, there has to be innovation. You cannot kill the goose that lays the egg. And the point is that if you start doing it in this manner, you're simply going to kill all the hens and the geese.
Sir, I'm sorry.
My point is,
sir, I'm sorry, but I'm sorry.
Law and other laws in the country,
Dr. Ganguly,
have a balancing
Dr. Ganguly,
so
what are you saying?
Innovations will be done.
Dr. Ganguly, you are saying here today.
What I'm saying is,
you are saying here today. What you are saying tomorrow is simply this. I'm sorry, I'm not generalizing. What you are saying tomorrow is that for the rich people of India and for the rich people of the world, it will be a society in which drugs will be available at a price directed and driven only by market economics. And we don't, 1 minute, we don't pretty much care.
I didn't say that.
We don't care.
No, that's not the point.
But that is the only point. That's why we are debating this today.
At all. If you look at if you look at the pricing policy in the country.
So what pricing policy, sir? So what pricing policy? Dr. Ganguly, this is the health sector. It can't have only a profit motive. India provides generic medicines which are a lifesaver for millions of people in poor countries that don't have the financial capability to foot bills of Western drugs. for cancer, malaria or HIV.
No, but please,
You are
please
saying let all the
please
people die?
understand. No, please understand that, hang on. No company in the world, whether an Indian company or a foreign company, will innovate or make things which are not applicable or available
Dr. Ganguly, Dr. Ganguly, tell me today. Dr. Ganguly, tell me today, India is already behind in research and development, and our people are also poorer. Does that mean? One minute, Dr. Ganguly. Don't be impatient to respond, Dr. Ganguly. Listen to my question. We are poor and our research, our development is also behind. We have a large and teeming population of poor people. You are saying that unfortunate mix of circumstances for you Indians. Unfortunate for you. But we can't help it. You'll have to suffer.
Well,
this is market economics.
I don't agree with that. If you see a person on the road not wearing clothes, you don't blame the textile industry.
Sir, I'm asking you today. I want you to address all the cancer patients whose life would have been affected. Today, if you'd been sitting here in this chair, I want you to address all those who may have cancer patients, their loved ones at home, unable to bear the cost.
Why don't you?
One second, please. I bring this down to basics. I'm asking you, what would you have told them?
I'm telling you.
What would you have told them? Take a loan, go to a bank, sell your house?
I'm telling you the basic.
Be financially crippled in your last and dying days?
I'm telling you the basic. Novartis has provided 95% of the drug free. Now, who else is going to foot the bill? Why don't you put the onus on the government to provide a safety net?
I put the onus on the government. I'm saying the government ought to do something. But how many poor children do you see on the streets of India begging who should be going to school? We are not a social welfare society. Please don't forget, sir, we are not Scandinavia.
Yes, but Novartis has done its part.
We are not Scandinavia.
But Novartis has done its part. Why are you blaming Novartis for this?
I am saying we are not Scandinavia.
I mean, if a person cannot afford medicine, you cannot blame a pharmaceutical
company. If a person cannot afford medicines, you cannot blame a pharma company. But if a person cannot afford medicines because a private company in the West has to make money,
then you need to change the funding pattern of our research.
Sir, that's a long term. And in the interim, Indians can die.
No, it is not.
In the interim, poor Indians can die.
We need to discuss what is the alternate mechanism to provide access.
Anand Grover is responding. Anand Grover, please. Lawyer for the Cancer Patients AIDS Association. Last word tonight.
Let us take up this bogey. Let us take up this bogey of innovation. The industry claims that they actually spent $2 billion on a new blockbuster product. Now, there are studies done by government included, US government. First study was done by a Congressional Budget Office which said it's only $200 million. There was another study which put it to $100 million. The latest study shows that they are only spending about $50 million. But they have claimed $200 billion. Books are not opened. Nobody knows how much money they're spending. There are estimates which show only $50 million now. But on $50 million or even $400 million, they make $1 billion per year. So they recoup their profit. This is from the Novartis' own website, own data. So Prabhuda Ganguly, you may not want to agree with it, but that's a fact. Perhaps you have some liking for Novartis making a lot of money. But please understand, this is from their own data and they have not challenged it. In the court, this is what we put, they did not challenge it. So they do not spend money on innovation as they claim. Otherwise, their books of account should be open, but they don't want that. And 80% of the so-called money they spend is on sales. Please understand that. Don't make profits for profit's sake. One. The second point about today's case is that new forms of known substances should not
Okay, one sec. Prabhuda Ganguly, finally, yes, Prabhuda Ganguly comes in. Prabhuda Ganguly.
Should be patented.
Prabhuda Ganguly is responding to you, please. Let him respond.
New forms cannot be patented. That is the point.
I think the judgment, I think you're wrong. I think the judgment which has come in...
I think you're wrong. Please read the judgment. I appealed in
narrow interpretation
but that's your view. You can have a view which is wrong.
I've read the judgment.
There's no difficulty about that.
What I'm saying, I don't agree with it.
No, I've read it.
What I'm saying.
But you may not agree with it. That's your problem. That's your problem. That is your problem because it is not to your liking.
The point is
But it's not to your liking. What can we do about it?
The interpretation that has been given. No. I'm just saying what I'm saying is that the interpretation.
Yeah, but that is the interpretation which is correct now. That is the law of the land.
Gentlemen, whichever way we look at it, there's only one thing I want to say. We are not. No, gentlemen, one thing. Today's judgment of the Supreme Court of India is a lifeline for thousands of cancer patients.
It is.
Today, for a lot of people who are worried, will we be able to afford medicines if the foreign companies try and push their patent monopolies on our country? I cannot tell you, sir, how many people would be relieved today. How many people would be? That's not an emotive issue. It's a real issue.
Any patent will.
It's a real issue. For want of time, I'm wrapping up the debate, gentlemen. I promise to pick this up once again on the Newshour tonight.